Yeah, so my interest is really, the first question is that what's the process for us coming back for deliberation and discussion on the allocation for the $17.6 million that came to us to support all of our public health efforts, vaccination, contact tracing, management of this going forward? What's our timeline for that?
Through the chair and Director Robinson or Amelia may have the date. We are expecting more direction from the state on these funds by the end of this month. And we have to submit a plan. And I think the date to submit the plan is coming up soon. I don't know if Amelia has that or Director Robinson.
We don't have the date yet. The state is supposed to be releasing the information by the end of this week. And there's also a webinar scheduled for local jurisdiction to attend on March 5th. So we'll have more information at that time.
Okay. So that'll come back to the board on a COVID update. Is that correct, CAO Bratton?
Yeah, that would be the best option from an agenda. We're doing COVID updates every other week, and so that gives us flexibility to bring it back on one of the COVID updates.
Well, so that for me, that money going out to counties, we fought for that through all of our county networks. Everybody's going to have their own kind of view of how they need to do it, but that needs to support the internal needs of us going from really the budgeting of the past year. We only budgeted through, I think, the end of June of this year. So that's one thing, is our internal needs that come out of Department of Health Services and others. But then the other side of it is that we have to investigate is our community partners. And if we're able to, I would rather that money come internally unless there's needs and gaps that we have to fund in the community. And when I think of gaps, I'm specifically pointing towards the federally qualified health clinics. There's other counties that are doing vaccines directly because they have county health systems. But I don't know about the rest of the board, but if you've reached out to your federally qualified health clinics, there's a variety of things that they're dealing with, right? With the ability to do the outreach, how much it costs and what the reimbursement rate is, and then how hard it is to actually get people to come in who are in vulnerable classes, who quite honestly might not trust the government in many ways and have to do outreach and research. So what I would like to see is, and I don't know if we need a motion or direction to staff or whatever, is a discussion with the federally qualified health clinics specifically, because that's going to be the primary partnership for us to get the equity out there, to identify what the gaps are, the real gaps, not the, hey, I have this much, it costs me $160 a patient. If I lose the opportunity cost, it costs me $80. This is how much it costs in this degree. But I've had some conversations with mine. I don't know if the rest of the supervisors have. Many FQHCs have had to move from even doing testing and other things or contact tracing completely over to vaccines. So I really want to see what that is. And I want to make sure that we're in a position where if there's a need that we can support them. That being said, the other side of this is that Dr. Shende, Barbie Robinson, Dr. Mace, we've been on some calls with our federally qualified health clinics, and there's been a discussion on if some of that is FEMA reimbursable as well. And if some of that's FEMA reimbursable, some of that work on vaccinations, I'd love for us to look with either with Chris Godley or with DHS, is to look at if there is anything that we're leaving on the table with FEMA. Obviously, our health clinics can't do FEMA reimbursements, but there might be an opportunity for us to float some of that and then get the reimbursement back to through us. So I'm not trying to fix a problem that we don't have. Currently, there is a problem with the FQHCs. We might be able to solve that through advocating to the state for them to increase the reimbursement rate or provide other stuff through the third-party administrator. But I don't think that we can assume that that's going to be taken care of. We have to be ready to see what those gaps are. So I would love for that consideration to come back with potentially an upcoming COVID update, or with with the actual funding allocation of the $17.6 million. So I'm just interested in my colleagues' thoughts, and also Cheryl, if you have any thoughts on this as well.
Cheryl, do you want to jump in?
Just a couple of notes for the board. The funding, the 17 million, has a time horizon through July 2023. So it's potentially 2 years of funding. It is for, testing, public health surveillance, enhancing laboratories, coordinating and engaging with partners, as well as vaccines. So it has a focus area, but pretty broad. In terms of FEMA reimbursement, I would recommend that it's not Christopher Godley's shop, but Ryan Burris and Auditor, Controller, Treasurer, Tax Collector, and my team working with health to figure out, where there's opportunities and what that might mean. So those are the only things that come to mind in terms of sharing. I do think it would be good to get board direction if there's board direction to go engage specifically with the FQHCs and trying to assess what those gaps are. I think that would be good for staff to get that direction.
I have a quick question, maybe for Director Robinson. Are there any other potential sources of funding for the FQHCs?
Yeah, early in our vaccine effort, we had conversations with FQHCs and solicited information regarding what additional funding would be needed for them to ramp up and engage in getting shots in arms. And the California Medical Services Program, CMSP, is a potential source of funding that could be available to our county that could help augment and support our FQHCs. I know the needs are different, as Supervisor Gore mentioned. Some have expressed, hey, I just need an additional amount to support the vaccine efforts. Others are saying I need funding related to opportunity lost for serving patients. And so I do think that more detailed analysis and more information about the unique and individual needs of each clinic is necessary, but I do think potentially that the CMSP may be a potential source for us.
So I certainly support, just speaking personally, looking into how we can fund and support FQHCs, and also identifying and trying to quantify what the overall need is. I really think that they're the biggest sort of quiver in our, arrow in our quiver in terms of addressing the equity issue here in Sonoma County. And they're going to be critical partners in the months to come. Ken, I see you unmuting. Do you have anything to add with respect to FQHCs?
Only I do want to remind everyone out there that we're putting substantial resources into supporting the vaccine clinics and the FQHCs currently. For example, we have approximately 180 workers out there working with the FQHCs currently at no cost to the FQHCs at all. We've provided space, and we've provided other resources to them. So I know there's a whole lot more that they need to be successful, but I do want to remind everyone that we're putting some substantial resources out there to support them.
Supervisor Hopkins, if I may, Ken, I appreciate you bringing that up, because it has lowered the costs. Like from our discussions, I know Barbie in our discussions in one degree, they were quoting very exorbitant costs of like, the opportunity cost of us using our own doctors and our own clinicians is if we're not billing to Medi-Cal for other stuff and we're doing this, it could be up to like $100 or $80, $100, $120 of a deficit per patient that they work with. But on the other side, I understand that, like from what I've seen from some of the pro formas that I've asked them to put together, is that with the support of that staff, either coming from the state or through us, that's dropped to like, $40 for the cost of it, whatever. I think we still have to understand that the outreach cost for the most vulnerable is always more expensive than it is for the traditional in any work we've done. I give an example. My brother, who manages a vineyard operation, recently, he was very proud of the fact that they got 36 of their farm workers vaccinated, and he worked his tail off. And as a bilingual manager who has a good relationship with his workers, it took a significant amount of time to work through the issues, to get people logged in, to deal with the technical issues that were out there and other things. And so once again, I'm not advocating to try and fund something or throw money at something that isn't there. What it is that this still is a nut that's yet to be cracked and fixed. And I think it's going to evolve and move through. And I think I would just hope that we would dive in and try and get some consistent understanding from them with pro formas and other things that they need to meet. As an example, I asked the Northern Sonoma County ones that predominantly do farm workers up in my areas, in the prime farmland areas, to come up with something. And they're not asking for the county for a ton of money. The healthcare district recently put in $260,000 to support them. The Healthcare Foundation put in another $50,000, right? And so what they're saying is there a gap of $18,000 that you could match us with out of the county to help support this on this outreach call? And so in some degrees, it might not be, we might be able to get at that through a different mechanism while we're trying to get to the true reimbursement. But in the meantime, we can't expect that these clinics, which run on a shoestring budget, and Medi-Cal recipients to be able to do it all without our support.
Does staff have any response to any of that? Or it looks like Supervisor Corsi, you want to jump in, and then maybe we can let staff respond and talk a little bit more about the FQHCs.
Right, and I just want to add my support to engaging with the FQHCs to find out what their needs are. But I'd also like to hear from staff, if not now, later on, what opportunities those local health clinics have to get their costs reimbursed as contractors to the third-party administrator, and whether the outreach that they're doing is part of those kind of contracts, or if it can be. So those are my questions at this point.
So I will have other staff chime in. But one of the issues for our FQHCs is typically the outreach cost is not covered. And so that has been a challenge for them in terms of the work and services that they're providing. And we know that we all need to do outreach, and it's a critical component, especially given vaccine hesitancy. So that is something that we will have to address. I will turn it over to the team. I'm not sure, we've seen the contract, but I'm not sure if we've combed through it and looked at the details of whether or not there's what the terms are in terms of regarding reimbursement between the FQHCs and TPA. I did want to address part of what Supervisor Gore said as we go back and do the research and come back with the proposals. Opportunity lost costs are not typically FEMA reimbursable. So I just want to be clear in that in terms of direction. I know that FQHCs, I'm not sure Ms. Gabriel could speak to this, but in terms of the FEMA rules, what has happened in past disasters is, it's a long road for reimbursement. We all know that with FEMA. And so there's not the appetite or interest from FQHCs in terms of exploring that process. And I'm not sure what the guardrails and rules are as a matter of policy internally to the county in terms of eating those costs and then subsequently trying to get reimbursement from FEMA on our own. So that would be something we'd need to come back and perhaps have the auditor's office explain in further detail what potential limitations or opportunities there may be. And I don't know if there's anyone else on the team that's combed through the TPA contract to answer Supervisor Corsi's other question.
No, not yet. We did receive a copy of the contract between TPA and the county, and we are awaiting the contract between the FQHCs and TPA. They should be able to get that to us by the end of the week, and we will look over it, and we will have council look over it as well. I don't know, Ken, if you have anything to add.
I just, one thing was I recognized what Supervisor Gore was talking about, the support that is being provided by employers is substantial in terms of helping employees get into various clinics and sign up. It's much more difficult that for people that don't have that level of support. And I know that the community health clinics are working very closely with community-based organizations to help that happen. And just last Wednesday, we had conversations with the community clinics about helping engage other community-based organizations that they may not be connected with, or that approach us and say, we can help, to try and connect that together. So we're having a great deal of conversation with that, but admittedly, it is a significant gap. And I know Denya Candela has been doing a phenomenal job at trying to make those connections and between the clinics and the community-based organizations. So, but I do want to recognize Supervisor Gore's comments about, there's some groups that are able to give more support than others, and we need to help fill that gap and make those connections.